Assalamu alaikum everyone, this is Dr. Hasana back with another amazing concept video, and literally this is a very OG video, especially for people that are looking for a short way to know the entire autonomic pharmacology. This is my biggest hack. I haven't seen this anywhere. I made it all on my own. Yes, I used to be an anatomy teacher, but now I'm going to be your pharma queen. I'm going to make pharmacology easy for you. So guys, this is actually, I don't want to take too much credit for this. All of this that I'm going to teach you right now is all taken from my board for the course that I filmed of pharmacology. So in case you didn't know, I have a whole pharmacology course started, pharmacokinetic, dynamic and autonomic nervous system. And while I was filming the course, I realized how about post a YouTube video on, a really cool hack that I learned as I made this course for you guys, made this pharmacology easy for you guys. And that hack is something that I really want to touch, especially for people that are looking for a very shortcut way. Maybe they're watching this before, one day before their exam. For them, this is going to be genius. Okay. So see, I have this amazing idea. Okay. And I want you to know that if you want to learn about a certain drug group, I get it, that's like 4 drug groups and it's kind of like too overwhelming for you. For that, I have made this really cool way to know all the 4 groups, even if you don't know anything, right? So especially the ones that want to pass in a shortcut, which I don't recommend, obviously, you guys need to watch this. Now look, there are 4 groups in the autonomic nervous system. We have the cholinomimetics, then we have the cholinergic antagonists or the anticholinergics, then you have adrenergic agonists, meaning alpha and beta agonist, and finally the blockers of the sympathetic. 4 systems, that's a lot to learn. Sometimes you even forget things that you learn, honey. But then I come into this world, for some reason God's like, throw this person, make her born, and here we are. So guys, what I want you to do is, for every system, learn the learn the catchphrase. That's what I want to teach you. When it comes to cholinomimetics, if you can't remember anything, at least remember the side effects of all of them. And there is a catch to learning the side effect. You don't need to just go ahead and be like, dying, killing, and please don't do what you're about to do. Obviously, that's what you were going to do tomorrow in the exam, if you had an exam tomorrow, which is why you're watching this, obviously. You're probably going to go like, nausea, vomiting, diarrhea. How convenient, right? You won't need to do that anymore, okay, with this hack. So, honey, whenever cholinomimetics comes into play, always remember dumbbells, okay? Whenever anticholinergics come in the way, don't forget a poem. So you guys probably memorize the Humpty Dumpty, Mary Had a Little, all of those. Why should this be a problem for you? We're gonna get to it. Whenever they talk about adrenergic agonists, this is an OG thing. Like it's an OG thing. I made this on my own. With adrenergic agonist, you have to remember this guy right here. It's the catch. It's the hat on an insomniac. Whereas if you go to adrenergic agonist, you have to remember that there's an OET exam. You have an OET exam on February. But for now, just focus on the pharmacology exam, right? So let's talk about them one by one. If you can just remember these catchphrases, you can do everything, and I'm going to show you how. So what you're going to do is, firstly, thank you for trusting the girl in this tiny box. I assure you I won't disappoint you. First thing is cholinomimetic dumbbells. At least learn their adverse effect. Always remember, adverse effects are basically an exaggeration of the effect of that agent. Okay, so if we know the adverse effects, we can somehow get to the effects, right? So this is what I kept in mind. So listen, whenever it's dumbbells means it's you have to remember it's a mnemonic. Okay, so D for defecation and diaphoresis. These cholinomimetics, they make you like rest and digest overactive. So digest is going overactive. So defecation, you can see emesis, you can see salivation, you're digesting stuff. And then you have to rest as well, going crazy. Bradycardia, bronchospasm. Bronchospasm, because see, you don't need to do much when you're like resting. You don't need your lungs to go crazy, right? But when you're running, you need that. So in case of resting too much, that's what happens. So it's like parasympathetic overdrive. This is what happens. Apart from that, everything is like coming out. Like the person is just getting like really all full of like stuff going on, like urination. And M is for meiosis. So remember, your pupils go smaller when parasympathetic is overdrive. Okay, so that's the least you can memorize, right? Lacrimation, you're crying a lot. Okay, and everything that's like just your land is just too amazing. Like there's so many plants growing because there's a lot of like water, you have a lot of irrigation stuff, no problem with that, honey. And then you go to the cholinergic antagonist. What I want you guys to remember is bring that auntie into your life. Okay, that one auntie that is kind of like always looking at you like because her own land is so barren and dry, because her life is so dry, she's looking at you. She's, using you for her entertainment. I'm sure everybody relates to it. I'm sorry we have to like kind of, uh, you know, be rude to aunties and maybe like even talk ill of them just in order for our exam. So you know what? One day those aunties might actually come to your OPD. You became a doctor because of them, right? So cholinergic antagonist. I want you to remember this poem. It goes like, hot as a hair, dry as a bone, blind as a bat, red as a beet, and mad as a hatter. It's just like a poem. So, okay, poem learning should not be a problem for a medical students. And if you do have a problem, I'm sorry. That's all I can say. Okay, so what does it mean? Hot as a hair, the symptoms or side effects of the anticholinergics, because the auntie is like looking at you, right? So she's gonna go for mydriasis. The pupils will go like larger. So it's blind as a bat. You become blind because you know when your pupils go larger, your ciliary muscle in the back also undergo relaxation. So when they relax, you can't focus that well. So for a shortcut method, just remember blind as a bat. Like your focus is gone. Like you have blurred vision. Okay, blind as a bat. Red as a beet is basically your vessels get flushed. Your face becomes flushed, meaning vasodilation everywhere. So you look red. Okay, then you have a dry as a bone. Why are you dry? Because see, if parasympathetic was causing like overdrive of like wetness, then in these people it will be dry stuff. So dry as a bone, meaning you're not crying, you're not salivating, you're not like there's no moisture on your skin, you're not sweating, all of those things. Coming to mad as a hatter, it affects your CNS, it makes you hallucinate, it makes you see things, and it makes you like, insomniac, it can make you like, anything you want to say, sleep disturbances, all CNS side effects. Coming to hot as a hair, you become very hot because you're not sweating, so you've lost the thermoregulatory mechanism to bring down the body temperature, because that's what sweating is for. So if you've lost sweating, then your body temperature goes high, so you're hot as a hair. So the auntie is like, she's hot because she's jealous, right? Not because she's hot apparently, right? That's so rude of me. Like aunties probably like mad at me. So shout out to aunties, although like the best people in the world. Yeah, I'm just compensating. So coming to adrenergic agonist. Now this is an OG one I've made through while I was filming my course. I just came up with this. For adrenergic agonist, I want you guys to remember the catchphrase, hat on an insomniac. Okay, so you can see already the HAT. Let me just get a better pen out, right? So the hat on an insomnia. So we already know the first thing is the side effect of adrenergic agonists should be insomnia. Yes, because see, adrenergic agonists are causing sympathetic overdrive. So what happens when you're sympathetic overdrive? You get anxiety, you get like tremors, you are like having a headache, you're having like, you're just having second thoughts, and you just want to run away from the, probably the auntie that's looking at you, okay? Everything's just relating and it's becoming a story, wow. So hat on insomnia, remember, where do you wear your hat? You wear it on your head, right? So you have a headache. H is for headache. Why do you have a headache? The cause of the headache is because sympathetic system causes hypertension. Okay, A is for anxiety because sympathetic overdrive, and A is for arrhythmia. Why arrhythmia? Because whenever your heart goes crazy bumps, crazy beats, it eventually causes something we call as arrhythmias. T is for tachycardia because obviously your heart rate is going crazy, and T is for tremor, as I told you before. And then you have insomnia, especially for the drugs that can penetrate your CNS. So this is adrenergic agonist side effects. If you can remember that, so good, right? Coming to adrenergic antagonists, you have your OET exam on February, my love. Okay, hopefully you can first focus on this exam, then you can think of that. Okay, let's do this exam first. So for OET in February, I want you to remember that alpha blockers and beta blockers have different side effects. Okay, alpha blockers have their own, beta blockers have their own. Okay, so alpha blockers are the OET and beta blockers are the FEB. So what is the mnemonic, honey? The mnemonic is alpha blockers. They cause, because they're blocking sympathetic, so obviously they'll cause the opposite of the agonist, right? So there shouldn't be hypertension, it should be hypotension. So it's orthostatic hypotension, means the person, when he stands up, he has drastic like blood pressure gone down. Orthostatic with positional. E is for ejaculation dysfunction, meaning your ejaculate fluid might even go into retrograde ejaculation. This is a bonus point. I want you guys to keep this in mind. In Vivas, literally a person who just watched this video day before their exam can actually impress the Viva teacher by this point. So T is for tachycardia. Let me explain this to you guys. Listen, we have this reflex in our body. It's called the homeostasis system, and we have a reflex. Whenever the body detects, it's a baroreceptor reflex. You have these pressure receptors on your neck. When they detect blood pressure going low, they cause a reflex tachycardia. They tell your vagus nerve to stop shut up, because vagus nerve is parasympathetic, which causes bradycardia. They tell it to stop, so tachycardia. So whenever anything causes a high blood pressure, it will cause reflex bradycardia, whereas anything with a low blood pressure will cause reflex tachycardia. Keep this in mind. Very important points. Coming to adrenergic agonist, you can apply that. If someone's causing hypertension, then they're also causing reflex bradycardia. Keep that in mind. More exaggerated by norepinephrine. If you can remember that, that's just jackpot. So let's talk about beta blockers side effects. F is for fatigue. They cause you fatigue because see, if you're beta blockers are mostly associated in the heart, right? And when your heart, if it's blocked, that means the heart is pumping slowly. So if something's pumping slowly, then obviously if your heart is not functioning that well, it's slowed down, you probably will have fatigue. Obviously, so F is for fatigue. E is for erectile dysfunction. This was ejaculation. Keep that in mind. This is erectile dysfunction. You are having issues with the getting erect. Okay. And B is for bradycardia. Why? Because your heart, you remember, it went slow. It's not the reflex bradycardia, it's just a general bradycardia caused by beta 1 side effects. And obviously, how can we forget the beta blocker side effect, which is bronchoconstriction. Very important, bronchospasm, right? It's going to be similar. So whatever adrenergic antagonist will do will be similar to parasympathetic system, whereas what the cholino antagonist will do will be similar to the sympathetic system. I hope that makes sense, because these two systems are completely in a tug of war and like against each other, right? So my point over here is now, like, let's gel this in together and tell you how you're going to memorize everything, 4 systems in no time, right? So this is the Dr. Hasana's law. Let's make it that, Pharma Queen law. Okay. So basically what I want you guys to remember, if anyone, maybe your exam comes and they say that a patient is presented to you, he is having urination, excessive lacrimation, he's coming to you with defecation, instantly your mind will think this, he probably is on an overdose of cholinomimetic. And they might ask, what is the treatment? So you'll instantly know the treatment will be cholinergic antagonist, right? For instance, they say, what are the effects of atropine? You know that atropine, let me just bring my box down. I hope the box doesn't mind. Atropine is a cholinergic antagonist, right? I know it's an antagonist. So what could be the effects it causes in the system? You can go back, right back to your side effects and just de-exaggerate the side effect. I hope that's a word. Undermine the side effects. So if it says hot as a hair, just say high temperature of body, fever, dry as a bone, decreased salivation, blind as a bat, minor blurred vision, mad as an apple, sleep disturbances. No need to say hallucination. That might be like too much, right? So we have to undermine the things. That's how you work, right? Now, for instance, they ask you, well, what are the contraindications for adrenergic agonist? When do you not give an adrenergic agonist? Epinephrine, norepinephrine, all of these are agonists. So what is the contraindication of epinephrine, for instance? So if you guys know that the side effect was, what were the side effects? Hypertension. Obviously, you're not going to give it to a hypertensive. See how much this method makes it easy. If you know that the person has hyperthyroidism, already tremors, already tachycardia, why would you give these? So contraindication, hyperthyroidism, hypertension, honey. That's how it works. I hope that makes sense. If suppose they ask you what are the therapeutic uses of cholinergic agonists, right? So you can see that this person is causing urination to happen. So is there any disease which stops urination? It's most likely BPH, or maybe like you can say urinary incontinence, right? Sorry guys, I meant urinary retention. Yeah, obviously you're going to get this in urinary retention. While on the contradictory side, or like in contradiction to that, these drugs, they dry you out, so they don't cause urination. They cause the opposite of that, right? So if they're not causing urination, then in people who have urinary incontinence, the ones that are urinating a lot, you give it to them. So that's how you can think of, their treatment, their uses. How do we use an adrenergic antagonist? Okay, maybe in what disease do you need to stop the blood pressure to go down? Orthostatic hypotension. Hypertension, that's the therapeutic use for these guys. Okay, so for instance, you have, I need to slow down the heart because heart is pumping, arrhythmias. What is the therapeutic use of adrenergic antagonists, arrhythmias, because it slows the heart down, so the rhythm gets better. So guys, this is the way you memorize 4 systems in no time. And once again, I'd like to take credit. So all my course of my ANS pharmacology and my pharmacodynamic, basically I started teaching pharmacology just like this. I teach in the course. If you're interested to buy that course, the link is in the description. Thank you always for trusting me. Subscribe to my channel. Let me know if you want another video. I can make another concept like this. Thank you so much for watching.